Good afternoon, everybody. This is Bentley Ponder, Deputy Commissioner for Quality Innovations and Partnerships at the Georgia Department of Early Care and Learning. And thank you all for joining our third webinar during this COVID-19 public health emergency. Just a couple of housekeeping things. So unlike the other two webinars where you had a group of us all in a room and we were conducting the webinars that way, in this case, we're all working remotely, as we should, but that may create just a little bit of technical difficulties. So just a couple of things on that. First of all, this webinar will be recorded and we'll be able to post later in the day or first thing tomorrow. So if you get kicked off or something and there's something you wanted to hear, don't worry, we'll be able to post that. The other thing I would say is we recently, within the last, I guess about an hour ago, did a webinar with staff, and some of the staff that had difficulties with the audio had multiple applications open. So you just, you have a lot of things running on your computer, or if you're like me and you're working from home, but you've got somebody else who's also working from home, and there's a lot of strain on your Wi-Fi or internet connection, that can just be a helpful hint. The other thing that I would just say too is, as you'll see in just a second with our agenda, we do have a time for questions. We're going to have to do those just a little bit differently. So we're going to go around and everybody will be able to answer one or two questions, but anything we don't answer and that we haven't answered already, we're going to include in our upcoming FAQs. And with that, I'll go ahead and get started. So everybody should be able to see the agenda. And of course, we're in the midst of doing the welcome right now. In just a second, I'll turn it over to Commissioner Jacobs, and she'll give some updates and some different resources again during this emergency. I'm really excited that we have two guest speakers today that can offer their insights. Danielle Millman from Endeavor Schools will be our first presenter, and then we'll have Todd Harrison from PureFUN. And they both have some really interesting things to say, and I think you'll find that really, really helpful. Then we'll go through our updates, and you can see our different deputy commissioners who will be providing updates. And then when we get to the Q&A, we'll go back through this list, and each deputy commissioner will be able to answer one or two questions. And again, those questions that they were not able to answer, we'll add to our FAQs. And so with that, I'm going to turn it over to our Commissioner Amy Jacobs. And just so everyone knows, there does seem to be a little bit of delay in slides and speaking, so there might be some pauses between slides. And with that, I'll turn it over to Commissioner Jacobs.
Thank you, Bentley, and thank you everyone for joining us this afternoon for our webinar. We're calling this Webinar Wednesday. We did one with our staff a little bit earlier, and now, as of right now, we have over 900 participants on this webinar, so thank you for joining us. Bentley, there we go. So I just wanted to provide a couple of DECAL updates and reiterate one thing that Bentley said. So in addition to just DECAL updates, because we want to make sure you hear from us on new information as it becomes available, we've also invited Danielle Millman, who's the CEO of Endeavor Schools, to provide some really real-world guidance on how you can operationalize the new CDC guidance for childcare programs that remain open. I know that is a challenge and had an opportunity to hear Danielle present this last week, and we thought it would be helpful to you as well to actually hear from another provider on how her schools are implementing this. And then, of course, we know there are a lot of resources out there from the federal government, including SBA loans. I've heard there's been a lot of, but Todd Harrison, the owner of PureFUN, has some guidance and some feedback that we thought would be helpful for you all to maybe help you navigate that process. So we are grateful for Danielle and Todd for joining us on the webinar, and you'll get to hear them speak in just a moment. So a few updates from me. First off, I'm sure you're all aware of the governor's shelter-in-place executive order that is in effect until April 13th. In that shelter-in-place order, it does ask everyone and remind everyone to please stay home if you possibly can. It also recognizes the need to continue to go get groceries and go to medical appointments and make necessary trips out of your house, but if all possible, to stay at home. It does not close childcare. In fact, it closes maybe between 10 and 12 types of businesses, like bowling alleys, fitness gyms, nail and hair salons, things like that. It does not close childcare. The governor and DECAL continues to recognize how important childcare is at this time in serving essential personnel. So that order is currently in effect until April 13th. I did just see this morning that the governor has extended his public health emergency order, which was originally in effect through April 13th as well. He's extended that through May 13th. And that order really gives him some more authority to do things quicker if he needs to do that during this COVID-19 public health emergency. I do not know if he will be extending his shelter in place. He does have a press conference this afternoon at 4 p.m. And of course, we will all be listening. And if there's anything we need to respond to, we will do that as quickly as possible. But of course, you can also tune in to see what he says this afternoon at 4 p.m. A couple of weeks ago, Congress and the President signed the Coronavirus Aid, Relief, and Economic Security Act, or the CARES Act. And good news is it has a lot of money in it. Some of that money was specifically allocated for states for childcare. So overall, the big picture is $3.5 billion was allocated for nationally for all states, and of course then that will be distributed to each state. Georgia will receive funding from that $3.5 billion. We have not received the money. We have not received any guidance on how we can spend that money. We have not received how much we will be getting from that money officially, but we do think it will be substantial. We have begun planning to get that money out the door. When we have more specifics on that, you will hear more from us. Our main goal is to get that money out the door to all licensed child care programs. Whether you are a child care center or a family child care and learning home, our plan is to get that money out to the door to help you either continue to manage if you're still open or continue to manage if you're closed, because we know that those decisions have been made on both ends of the spectrum. We respect that, but our main goal will be to get that money out to you as quickly as possible to help you during this time and to hopefully sustain so that you can reopen when things get back to normal or continue to maintain things during this time. So more to come on that, but I hope that is positive news to you, and we will get that information as soon as we possibly can. Sometimes the federal government works a little slowly, but we feel confident we will get it. We will have a plan in place and we can get it out as quickly as possible as soon as those dollars hit our bank account. As far as closings go, as you know, all public schools are closed now indefinitely for the rest of the school year. And as a result, we did close Georgia Pre-K through the rest of the school year. Susan Adams will talk a little bit about that later. And then just recently, I did close our Capitol Hill offices at DECAL through April 30th of 2020. We are still working. We're still working very productively in our homes. And so I hope that you do not see the impact of that office closure. We're still getting the mail and things like that several times a week. So things should process as normal. Also, you'll hear a little bit later about some of our continued supports for providers or families, whether it's a webinar or it's a training or whatever it may be, or resources on our website. We're also continuing to engage with our advocacy organizations and our other state agencies. And then any additional communication efforts. We just recorded a podcast that was released today. We will continue to do those weekly, and they'll probably always be on COVID-19 at this point, just another way to communicate, keep you up to date. And of course, our social media is probably the quickest way for you to get information, and our website, of course, is updated daily, if not multiple times a day. Also wanted to mention one more thing that just came out around noon. The governor and DECAL, we issued a release reminding police and local jurisdictions that childcare is still open. So what we had heard from several childcare providers that their staff and their teachers were being pulled over by police when they were traveling to and from work. And so we worked for the governor's office to reiterate that that is not something the police should be doing, that they can go to work, they are essential, and not to pull them over and threaten them. So we hope that release will be helpful to your staff if they've encountered any of that. Next slide, Bentley. So just a reminder, the Department of Public Health is still your best bet to look at information on new cases and new testing and information as what's going on in Georgia. And then, of course, the CDC continues to update their information as well. So just a reminder on those two sites. Next slide. And then, of course, our frequently asked questions, we update those daily. It's probably up to 50 pages at this point. We're just adding to it every day so that there is a one-stop shop for you to find that. We did change the format just a little bit. So anything that's new for that day will be highlighted. I believe it's in red, and it will show you what is new for that day so that you do not have to scroll through the whole document. And then the next day, obviously that information will move to its appropriate section, and the new information will be at the very front of the document in red. So I hope that's helpful, as that document is a living document and we continue to add to it every day. And then, of course, as I mentioned, social media. You can follow us on all of the platforms: Facebook, Instagram, LinkedIn, Twitter. You can follow DECAL, and you can follow me as well. That's where we are also posting updates. So if you want a quick update, those are places that you can follow us and get quick updates as well. And then some new supports that we just launched online. Last week, we launched Georgia Pre-K at Home. Since Georgia Pre-K is now not going to reconvene for the rest of the school year, we did put Georgia Pre-K at Home out. They have daily activities that families, teachers, anyone can access and do with their children at home. Just this week, we have released Toddler Time at Home, which is the same type of thing, but just for younger children, trying to make sure there are some activities, not too hard, not too overwhelming, but help to keep young children engaged. And then coming soon, we're going to do some more things for families and family chats, and then put out some school-age resources too, since we recognize that many, many school-age children are at home as well. Next slide. Okay, so now I will turn it back over to Bentley.
All right, thank you, Commissioner Jacobs. Well, I'm very excited to introduce our first guest speaker today. Danielle Millman. She is the COO, Chief Operating Officer for Endeavor Schools, and she self-identifies as a passionate advocate of early childhood education. She is on the board of GCCA and has also served as a teacher, facilitator, leader, and adult learning coach for over 22 years. So Danielle, if you could unmute yourself and just let me know when you want me to advance slides. Just again, know that there's a bit of a delay.
That's great. Thank you so much, and good afternoon, everyone. As you know, I'm sure many of you are spending a lot of time on the CDC website and checking their guidelines and recommendations for us on how to operate safely. Throughout March, they've published guidelines, and they've updated those 3 times during March. In the middle of March, they gave us guidelines talking about doing health screens at the door and limiting visitors in our classrooms and in our schools, asking us to consider modified hours and eliminating family-style meals. They talked through disinfecting all of our frequently touched surfaces and tracking absences that are based on travel and illness, and of course all of the hand washing, sanitizing. They've put out some great posted notices that you can put all over your schools, anywhere that folks are frequently outside of your schools as well, and recommendations on ways to keep children and your staff as safe and healthy as possible. At the end of March, they published some additional recommendations and guidelines that were more detailed and a little more complicated as we looked through those guidelines and trying to understand how we could operationalize those and make sure that we could still support children, educate children, and keep them at the forefront of everything we do while implementing the guidelines and really getting to the heart of the intention of the guidelines. You can go ahead and move this slide forward. So on the 31st, they published specific guidelines around each of these categories. Social distancing, more details on cleaning and disinfecting your buildings, and then specifically cleaning and sanitizing toys and they went into great detail about the kinds of toys, how to do it, the process, which is very helpful, and I recommend spending a good amount of time reading that. They go through bedding, drop off and pick up, and then infant care, hand hygiene, which many of this is already in line with right from the start and the things that we do every day. There are two pieces of the guidance that they put out at the end of March that were particularly unusual for us to talk through and understand, and so that's where I'm going to spend most of my time focusing today. And that first one is on social distancing. You can go ahead and move the slide forward. So the social distancing, one more, sorry. The social distancing that they talk about is important for several reasons. So we know that our group sizes, we don't want more than 10 individuals in a classroom, and those 10 individuals include our staff. And it's important to really be thoughtful about keeping those groups as contained as possible and how you keep those groups together. When you start your day at check-in and you're doing your drop-off for the mornings, you're meeting parents at the door, receiving the children, I'm sure you've been to the store and you've seen a visual or a physical representation of what 6 feet apart looks like. You can use cones as a nice visual cue for your parents on where they should be so that they're not in line too close to each other. You do want to make sure that folks are not congregating in the lobby. And the group locations, you don't want your groups to be mixing. So you don't want classrooms out on the playground at the same time. You don't want classrooms rotating through a music room or an art space. It's important to keep your groups as contained as possible, which is very counterintuitive for who we are and what we want in our schools. Normally, we are very engaged and emotionally connected, and we know that that's best for children. At this time, it's really important and best for the group, your staff, and the students to try to be as self-contained as possible inside their 10-person group. Because if you have a positive case being a student or an employee who tests positive for COVID-19, the CDC recommendation is that you close for 2 to 5 days and go through the disinfecting process. And the 2 to 5 days is based on how the virus is peaking in your community and the number of cases and what makes sense, but at a minimum 2 days. If you have a positive case and your groups have been mixing, or you have a staff member that's been very friendly and has said hello to every classroom and has eaten lunch in the staff break room, you are required to quarantine everyone who has had contact with that positive case. So if your staff member has had contact with every other staff member in the building, then you're required to quarantine all of your staff. And unless you have a secondary staff that you can call to reopen your building in 2 days, essentially your school has to stay closed for as long as your staff is quarantined. So in thinking through how you isolate and contain your groups, you want to think about the potential and preventing exposure in the event that there is a positive case that comes up. They also recommend at nap time that you keep cots 6 feet apart. In talking with the CDC, I shared that that's not always an option for us. That's a great suggestion. We have many classrooms that aren't sized well enough that we could have cots necessarily 6 feet apart. As far apart as you can get the cots is what's important. And you can alternate, so head, feet, just so you don't have two children laying right next to each other face to face is really the goal and the spirit of that recommendation. If you're accepting families from outside, so if you have a hospital near you and you've started to get calls asking for you to support medical families who their school may have had to close or is closed. The CDC recommends that you keep those outside families in a separate classroom from your existing community, and that you operate that classroom specifically for those outside families. You can go ahead and go forward. The other piece of the guidelines that was particularly interesting and had more stringent recommendations in it was drop-off. They had already talked about in the middle of March, the CDC had already recommended dropping off outside where we would receive the children and bring them inside, that the drop-off be 6 feet apart, and that we do our health screens, and that we record any students or staff through the health screen that are symptomatic, that we turn away, that we don't allow into the building. At the end of March, when these additional recommendations were published, the CDC also talked about additional recommendations on taking a temperature and using a mask, a face shield, making sure you have a lab coat on, of course, gloves as you're taking temperatures. The way that they described it was using PPE, the personal protective equipment. And in talking through this with the CDC, I shared that this is really a challenge for early childhood education to meet our children at the door, gowned, gloved, in face shields. For many children, that would be very frightening and would cause a lot of concern. And so we talked about how we could meet the idea of it and accomplish it without necessarily inciting all of the fear in our children. So lab coats are a really good solution for this. You can go to Walmart. They usually have lab coats and scrubs in stock. The idea is that when you're taking temperatures, that you have a lab coat on, that it's buttoned up, and during those temperature checks, you're wearing it. Once you're done with it, that you take the lab coat off. You're not walking around through your building with that lab coat on, that you take it off and you bag it, and then it goes to the laundry to be washed each day. And that's probably the most effective way to accomplish it without the disruption to the children. I'm sure you've all seen the recommendation that we be wearing masks. I think cloth masks have become a new part of our world, and the CDC does recommend that we are wearing cloth masks in our schools, that staff be wearing them, and that children 3 and older are wearing them. Obviously, children wouldn't be wearing them when they're outside, when they're napping, when they're eating, but cloth masks are part of a cloth face covering or mask as part of these CDC recommendations as well. You can go ahead and advance the slide. Another piece that they added in these guidelines and recommendations is caring for infants and toddlers, and they specifically talked about your staff that are in infants and toddler classrooms because of the high likelihood of excretion, so spit up or things like that. They also recommend that all staff that are infants, that are caring for infants and toddlers, have a smock, an apron, or a lab coat over their existing clothes. And that when they come into the classroom, they put on that protective covering, whether it be a smock, apron, lab coat, or gown, if that's what you think makes the most sense for your school. And as it gets soiled through the day, that it get changed. And then as your staff are done in that classroom for the day, they take it off, bag it, and leave the classroom without the lab coat on. It's really important that they're just wearing that in the classroom, that they're not walking around the school with that covering on. The additional guidelines that they went through, one of the things that I would say in terms of cleaning and sanitizing, don't forget to sanitize your playground equipment. think through, as you're rotating your groups of children through the playground, think through how you can spray down your playground equipment. We've converted what we used to use. There's cheap sprayers that you can use that you might have sprayed for insects before. You can now use bleach and water and spray down your playground equipment, things like that. Just be thoughtful of those kinds of items, and how your playground equipment is also a frequently touched surface that you want to be thoughtful of cleaning, disinfecting, and sanitizing. Thanks.
All right, thank you, Danielle. That was really helpful and informative. As you were talking, I just couldn't help but just myself think about, how we're talking about things that, 2 months ago we wouldn't have dreamed necessarily that we were visiting. So I'm just going to say personally, I'm really glad that you're out there and sharing the information and talking with the CDC. So thank you very much.
Absolutely.
So our next presenter, our speaker, is Todd Harrison. Todd is the owner of PureFUN, and Todd, I hope this is okay. I pulled this from your website. PureFUN Incorporated serves the child care community by providing access to resources for child care and nutrition programs. I know many of you have worked with Todd before, and you are aware of his mission for supporting ECE by investing in resources that impact children and those that serve them. So Todd, take it away.
Sure, thanks. And what must not be at the very top of our website is what we do. We're food service, broadline food service, janitorial supply company. So we know a lot of you, especially around our wide metro Atlanta area. And if you're one of our customers, thanks. And we'll get through this together. So I was asked to come give you a little bit of information about what I know and have been learning about the SBA money that's part of that $2.2 trillion of relief program, the CARES Act, and especially as it relates to a program that's called the PPP, the Payroll Protection Program. I'm becoming intimately acquainted with it because PureFUN has applied for some of that money. As you may be aware, we are all and only child care, and the food and products that we supply in our business here around Atlanta is down probably over 80% in the last couple of weeks. So we're struggling, as you all are, with decreased business and volume and revenue. So I've reached out to my banker. We use SunTrust Bank, and am kind of becoming a student of this payroll protection program. So if you haven't heard about it, in very basic terms, this is an SBA loan that's going to be backed by the SBA through an SBA lender. So the chances are your banker is probably already a pre-approved SBA lender, and this is great. A great resource for us. And here's how it works. And let me just offer a disclaimer. I'm not a CPA. I'm not an accountant. I'm not an attorney. I don't work for a bank. I'm just a business person like you all are. So just trying to share this information. Here's the way this program works as of today. You can go through your lender, and most of them, I think, are putting up online portals to handle this money. Some of them may still be developing their portal. SunTrust launched their portal at midnight last Friday night, actually Saturday morning. I got on the portal about 6 a.m. and began to submit my application. The basics of the program are, you go back to 2019 and you calculate your average monthly payroll during 2019. And let's just say you're a program with, say, 20 people, 20 staff. Let's say your average payroll last year was $50,000 a month. You're allowed to, the maximum loan amount you're allowed to get is 2.5 times that amount. So if you're a $50,000 a month payroll, that would be $125,000 that you're allowed to apply for through this PPP, Payroll Protection Program. The great news about this is A large majority, potentially all of this loan will be forgiven, but it's initiated as a loan. It's initiated as a 2-year loan at 1% interest rate. But then once you get your loan and the day you receive your money and close on your loan, for the following 8 weeks after you receive your money, every dollar that you spend on payroll, and if you've laid people off, you can bring them back, or just keeping people paid that are in your school, and maybe you have people that are being paid that don't have a lot to do these days, but you're allowed to keep them all, bring people back, and every dollar you spend on payroll benefits, health insurance if you offer that, plus any money you spend during those 8 weeks on utilities for your building, plus any money that you spend during those 8 weeks either for rent if you rent your facility, or interest on your mortgage if you own your facility and have a mortgage payment. And then additionally, any money that you spend, any interest that you spend on any other debt you have that was in place before this started, I think February 15th. So let's just give an example. Maybe you have some vehicle loans or some bus loans. The interest portion of those payments is allowed to be accounted for as part of the forgivable amount of this loan. So what I think what's going to happen, it appears, is at the end of the 8 weeks, some point after, you'll go back to your bank with your documentation on here's how much I spent on payroll, all my payroll benefits, health insurance, interest, mortgage interest, utilities, and document and verify that, and that amount of that loan will be forgiven. Obviously, it's backed up by part of the $350 billion that they've allocated towards this program. And anything that's left over, let's say you borrowed $125,000 and you did your math and $100,000 of that was forgivable. The other $25,000, you can either give them their money back, or you can ride that $25,000 for 2 years at 1% interest and just pay it back as a short 2-year loan. And the good news is the payments on those on that loan doesn't even start for 6 months, so the deferred amount is 6 months. So I would encourage you, and here's what I've experienced. I applied. I think I was one of the first waves of SunTrust clients that applied Saturday morning. They have you upload documents. The most prominent documents is payroll documents like your 941, your quarterly 941 documents to verify your payroll numbers. And I've experienced some problems with SunTrust portal. They got it up, it didn't work. They asked me to go reapply. They're communicating pretty well on emails. They're letting me know that they're looking at it. I don't have my money yet. I don't know when I'm going to get it, hopefully fairly soon. But my encouragement to you is go apply for it. If your bank's not an SBA lender, go find an SBA lender. Apply for that money, be diligent. If they ask for documents, give them documents as fast as you can, because this is kind of a gold rush thing. And I think there are probably hundreds of thousands of businesses across the country applying for this. But if you have a good banking relationship with your bank, you ought to be able to work through this well. But be diligent, be responsive. Don't hesitate to apply and reach out. So again, that's what I know. And I'm appreciative that this money is available for all of us as small business people. PureFUN's a small business. We're not Cisco or US Foods. So we're sharing the same struggles. And that's about it.
All right. Thank you, Todd. I really appreciate that. And I've been doing a lot of reading on this too. And that's some of the most concise and helpful information that I've seen. So we really appreciate you doing that.
You're very welcome.
Thank you. And so now we'll go to our update. So Pam, I'm going to start with you and CCS.
Okay, good afternoon, everyone. It's nice to have the opportunity to talk with all of you again. I'm just going to go over a very few quick things. First, I want to touch on social distancing again, because we continue to get a lot of questions about that. So just as a reminder, with the new guidance around only 10 people in a self-contained classroom, with that, when you have that small group size, You don't have to maintain 6 feet of social distancing. Again, we've talked about this before. It's impossible. You can't feed a baby from 6 feet away. You know, the care that we give is important, and children play together, and we care for children in a close way. And so within that group of 10 of the teachers and the children, you care for children as you always did, in the same loving way that you always did. The 6 feet of distance doesn't apply in that small group. So just want to make sure that everyone understands that. I also want to talk a little bit about, we put out some new guidance because we've had questions about cafeterias and accordion walls in self-contained space. So, you know, big question is, if I have a cafeteria and if it has a bathroom, can I use it as a classroom? And the answer is yes. You get right now trying to keep your doors open with those small group sizes is really, really challenging. So yes, you can. But if you know, obviously we're child care services, so there's always a few little details to go with that. So yes, you can use your cafeteria. Again, it has to have 4 walls and a door. And we also know that cafeterias can be a high traffic area where sometimes you have to go through the cafeteria to get to another space. If that has to happen, if someone has to pass through, they have to maintain 6 feet of distance from everybody else. It's not a place to congregate. It's still a classroom. And then you also probably need to touch base with your consultant, because some cafeteria space is licensed to use as classroom space and some is not. So if yours is not, we'll have to do an amendment. So contact your child care consultant just to make sure. As far as, and also we want the cafeteria would need to be used for older children. It would not be a diapering room. You would not have a setup for diapering in there. So keep that in mind. That would be space for older children. For accordion walls, some programs do have accordion walls. If you have accordion walls that go end to end to completely enclose and make a new classroom, and if it goes from ceiling to floor and you can keep it closed at all times, yes. And as long as it's okay with your local fire marshal, you can use it. You can separate classrooms within the 6 feet of social distancing. So I hope that's helpful. Sign in, sign out. We're going to have to do this in a whole new way too. Obviously, we have to continue to sign children in and out because we have to know who's in the building. In case there's a fire, another emergency, you have to know who's in the building. And, you know, whoever's dropped off in the morning, got to make sure that someone has picked them up in the afternoon. But we're going to have to do it in a different way because these are different times. So if you have a computer system and families usually just punch in their number and log in that way, it's okay if you have one person that's doing that for everybody right now, one administrator or someone who is logging kids in and out. We understand that might be necessary. If you want to have the parents do it themselves and you have a tablet that you can take outside that you're checking people in and you can disinfect that tablet in between uses, you can let parents log in and out themselves. But you can also just use paper and pencil again. Go old school. As long as if you're keeping paper records, if you're using a pen, make sure you're have lots of pens, or that you're disinfecting pens in between uses if you have parents sign in and out that way. And then the last thing, really quickly, we are going to begin to do some virtual monitoring. And I want you to know that we're going to work in partnership with you guys on this. We know this is an extremely stressful time. You're having to do so many things in different ways and modify what you're doing. But also, if programs are open, we are mandated to monitor. So we are developing ways to do virtual monitoring. We're going to keep you in the loop. We are in the very, very beginning stages of this. Just so you know, too, we'll be by appointment. We will do this. We'll let you know what the process is, and we'll work with you so that we can do this together. So I just wanted to give you guys a heads up about that. And that's it for me.
All right, thank you, Pam. And next we have Elisabetta Casper, who's going to talk about CAPS.
Good afternoon. So many of you are already aware that CAPS has policy waivers. First and foremost, I want to let you know that those payment waivers and the others that you have already seen in the memo have been extended through April 24th. I know that that's been a question on many of your minds. And those policy waivers are in place for all of our CAPS child care learning centers and family child care learning homes. And you already are aware of the payment processes and waivers, as well as the approved activity for families and our suspension of provider rates. But we are adding 2 new policy waivers this time around. So as of effective today, as Pam already talked about, sign in and out or arrival and departure records, CAPS is suspending the requirement that a parent must, or the person responsible for dropping the child off, must sign the child in and out. We want to, of course, help facilities to keep their families and their staff as safe and healthy as possible in these times. And so that policy is temporarily suspended. As Pam mentioned, the methods that she mentioned, you can still keep track. Of course, it's important that you know exactly who's in your building at all times. And so it would be fine to let one staff person do the sign in out or to do it in the other ways that Pam described. Additionally, we're adding another policy suspension, which is that right now, there is a policy in CAP that you can't both charge for a bill for a child under CAPS and another program. That, under these circumstances, temporarily, that policy is suspended, which means if you are getting paid for a pre-K child, for example, that you're taking care of full-time, and now, and they used to be in your before-after program when pre-K was in session, and you're getting paid by CAPS now at a full-time rate for that child, you would be able to collect the money from both. That layered funding is temporarily allowed. So you will see that in the policy memo, and then we will reissue that to all child care providers and families this afternoon. So you will be receiving what I'm talking about in writing by this afternoon. The second thing I wanted to mention is you may already be aware from last week we released that on April 1st, a new essential services workforce priority group opened for CAPS. Again, this allows families in the essential services workforce to enroll their children in open licensed family child care learning homes and child care learning centers that participate in the CAPS program. And it allows families who may not have otherwise been able to be eligible for CAPS because they weren't in one of our other priority groups to get that child care assistance. There are 3 tiers of our definition. We have only released our tier 1, which generally includes your first responders, medical personnel who are in the healthcare industry, and those staff that support those industries. There's details in the memo that got released last week, and it's posted on our DECAL code. So if you're not sure who would qualify from the families that you have at your facility or who are contacting you, you can look there. And the way that they would get connected with us with that priority group is if you go to qualityrated.org, that is the place where you can search for all open child care learning centers and family child care learning homes. You would do the search, or they would, the family would do the search, and then there is a button on the search results page that allows them to have help finding childcare. That also allows them to do a pre-screener for our this new priority group. So please direct your families who are in that essential workforce. We will be talking about when the other tiers of this definition for for essential services workforce will open. And as soon as we have that information, we will definitely share it with you. Those other tiers would include other industries like the food service industry and grocery stores and others, other government employees potentially, as well as others even than that. So more to come on that. And I think that that's everything for the CAPS program. Thank you.
Thanks, Elisabetta. I know everyone's glad to hear about those updates and those changes. I know how hard your team's been working. All right, Susan, I'm going to volley to you for the next update.
Hey everybody, it's Susan Adams. I'm the Deputy Commissioner for Georgia's Pre-K and Instructional Support. I'm going to give you some updates today around Georgia's pre-K. Did close pre-K for the rest of the school year. You'll be happy to know that we ran payments yesterday. So it takes a few days for those payments to hit your account, but payments did go out yesterday. Thank you to everyone who got their roster submitted. That allowed us to get those, run that payment even a little bit early this year. I know that you're aware that lead and assistant teachers should continue to receive their salary and should not be required to report to the site. Some of you have asked about would it be appropriate for your teachers to do some online support to children and families during this time, and that's absolutely appropriate. We have a lot of pre-K teachers that are doing Zoom and Skype with their kids. They're sending home resources. Some teachers are working on completing their child assessments. We're going to be posting some additional guidance around those activities, and then also some essential activities that you might want to have your teachers do once the shelter in place is over. Things like coming in to pack up classrooms or assist with end of the year kinds of things. We also know that many of you have questions around additional program guidance since the pre-K school year. You know, we won't be going back into session. We are working this out to you next week. I know many of you are trying to figure out the best way to serve pre-K children that still need childcare while pre-K is closed. I've talked to many of you. Please remember that we're asking for you to use your pre-K funds to serve those children. We do want for those children to receive service for the 6.5-hour day that where they would have been in pre-K free of charge, because that's being paid with their pre-K payments. One of the things we have done, like Elisabetta spoke to a few minutes ago, was you are allowed to both receive pre-K payments for those children, but also to receive full-day CAPS reimbursement for those children. So you'll get some additional funds during that time. If you have questions about that, just feel free to email the pre-K box or to call me, and we can talk through that. I've talked to many people this week and come up with some solutions. So be looking for that guidance next week, and we'll try to get you answers to a lot of the questions you have. Thanks so much.
All right, thank you, Susan. And Ryan, up to you.
Hey everyone, this is Ryan Ringsrud. I'm DECAL's Deputy Commissioner for Finance and Administration. I'm going to give you a quick update today on our Audits and Compliance Division. As most of our providers out there are aware, DECAL's Audits and Compliance Division conducts audits, reviews, and investigations of providers who receive DECAL funding. Again, this applies to both family child care learning homes and licensed child care centers. As you've heard today on the webinar, as well as on previous webinars, many DECAL programs have enacted either emergency policies or policy waivers in response to the COVID-19 issues. To go along with that, I wanted to assure you guys that our Audits and Compliance Division is aware of all of these policy waivers and or emergency policies that are being put in place. We are currently working to revise our audit procedures to ensure that the standards or criteria against which we evaluate providers reflect those emergency policies and or waivers. And that's really just that if you're following the emergency policy, you will not be asked to repay funds at a later date. Now, just to be clear, that doesn't mean that no audits will be conducted or that this time period will be blocked out from auditing. It just means that you will be evaluated against the emergency policy or waiver for the time period it is in effect and not evaluated against the formal policy. That's it. Thank you.
All right, Ryan, thank you very much. And then, so I'm going to provide some quality rated updates. So first of all, as many of you know, we've been working hard towards what we have called our 2020 goal. And that 2020 goal is that all providers who are participating in the CAPS program would be quality rated by the end of this year, by December 31st, 2020. Obviously, to make that happen, we have to be able to do classroom observations and observations in our family child care learning homes. So therefore, since we're not able to do those at this time, we are extending that 2020 goal. So we're not going to put out a new date right now. We know that, I mean, we want to wait to see, you know, when child care is, you know, when we're all able to be, you know, back up and running at full capacity. But we do know that it will be sometime after June 30th, 2021. So we wanted to go ahead and give you that we would at least have a 6-month window. Obviously, as this public health emergency unfolds, we'll continue to look at that date and evaluate that date. We're also wanting to let you know that we will be suspending our quality rated observations. We had said at least until April 13th. We're actually going to extend that until June 30th. We know that many of you, when you go back to full capacity, you're not going to be, you know, the last thing you want to think about right now is having a quality rated observation. So we're aware of that. And so therefore we're extending those until at least June 30th. Now we may ask you, we're going to, you know, need to have some work with our assessors to work on reliability and practice sites. So we may be doing some observations before that time, but official quality rated observations will not be until June 30th, 2020, and we'll reevaluate that date as we get closer to it as well. You know, we've done a lot of work with the 2020 goal. I appreciate everybody, you know, coming together. I think last time I looked, we were over 70% of children receiving CAP scholarships were in a quality rated classroom. So we were well on our way to meeting that goal. This does not change the goal, it just extends it a bit. So with that, we're going to go to our Q&A, and I'm going to call on each of our deputy commissioners to answer 1 or 2 questions that they've received during the webinar. For those questions that we're not able to answer, we'll again incorporate them in our FAQs. So Pam, I'll start with you.
Okay, it's interesting. The questions I'm getting really reflect, I think, is what is most disturbing about this whole situation for everybody. Is when does this end? What's going to happen next? I'm getting questions about, you know, the group size 10 for child care centers, including the teacher, and for family child care learning homes, 10 people in the house at any given time. And we don't know when it ends. We don't know when it ends. We're getting also questions about what's going to happen this summer. Again, we don't know yet. And I think, you know, just know that we will follow and take guidance from what the governor tells us through executive order, and what public health is telling us what we need to do to keep us safe. We will continue to communicate with you guys, and as soon as we know anything, we'll let you know. And I know it's hard that there's no answer for those questions yet, but we will keep you informed.
Okay, thank you, Pam. Elisabetta, any questions you're able to address?
Yes, we've had several questions about the date being extended. It is extended till April 24th, and it does include quality rated subsidy grants as well. We've had a couple questions about that. And then we've also had some questions about the layered funding, and is it only for pre-K? It is for all state and federal programs, not just for pre-K. So Head Start and Early Head Start would be included in that. And then finally, there was a question that asked about if a family is enrolled in CAPS and is attending one program and another program has them on their rolls and is closed and is billing for them, how does that work? And the answer is we are only permitted under the law to pay for one program for an active CAPS scholarship. And so wherever that active certificate is or scholarship is where we are paying. So if the closed program, if the family does not move their scholarship, they would not, the new program would not be able to bill for that child. They would have to, the family would have to pay on their own. So that's, I think, the bulk of what we got at.
Okay, thanks, Elisabetta. Susan, any questions from you?
Yeah, I had a few questions. One of the questions that came from several people was about pre-K applications for the upcoming school year. Please know that we are still in the process of reviewing those applications, and we'll be notifying people. Of course, with all that's been going on, we had to put a pause on that. We will be notifying those, reviewing those and notifying people about new and expansion applications over the next month. So thanks for asking about that. I've also gotten a few questions about the summer transition program. Right now, we are still planning on doing the pre-K summer transition program this summer. We have a couple of options that we're looking at around potentially shortening that program if we can't do a full 6 weeks. Several people have asked if there'll be more funding available for summer transition. We don't know about any additional funding for that program at this time. If it's available, of course, we'll look at how to use that. I also got some questions about were specialists available, and of course your pre-K specialist is available to you. Just give them a call and reach out to them. And of course, all of our other specialists, our infant toddler specialists, our inclusion and behavior specialists, are available to all child care programs and family learning homes. Right now, they're offering Zoom calls with teachers. We're also doing a tremendous amount of online training, so that's available during this time. So if you need any of that, feel free to reach out. Thanks so much.
Okay, Ryan, any questions for you?
Yes, thank you, Bentley. I got several questions related to the funding and the CARES Act that Commissioner Jacobs mentioned in her remarks. And while I can't provide specific answers to each question that was asked, what I can say is that we're currently developing plans to get those funds to child care providers, whether child care learning centers or family child care learning homes, in the most efficient and effective manner we can. And once we have all the details in place for those plans, we'll share that message with all child care providers. I also, let me scroll up here. I got a couple of questions about nutrition services. The first question is whether or not we've explored the possibility for virtual training for CACFP. And the short answer is yes, we have. We are working on a CACFP virtual training plan, and that information will be communicated very soon. We initially were focused on getting our summer food virtual training plan going so that we could get our emergency feeding sites trained and up and running. And now we're doing the same for CACFP, and we're working very quickly on that. So stay tuned for more information. The other nutrition question I got was, is it possible that was related to milk shortages and centers having difficulty finding milk. And I just want to point out on that one that institutions should contact our nutrition services division if they're having any problems finding milk or other meal components. And the reason for that is that certain waivers are available for certain meal components, including milk. Our waiver forms are listed on our COVID-19 website. So please reach out to us and we can help you with that. Thank you, Bentley.
All right. Thank you, Ryan. And then some of the questions we've been getting related to quality rated. So one, just some clarifications on the dates. So the extension of the 2020 deadline will be at least 6 months. So we'll be past June 30th, 2021. The suspension of quality rated observations for this year will be at least until June 30th, 2020. So I realize having both those June 30 dates made that a little confusing. I've also gotten some questions about specific examples of I've signed up for cohort 3, but I'm not sure I'll be ready for my observation then. What does that mean? We've also had some questions about portfolio submission. So I will say that in the FAQs that we'll be releasing today, there's some specific guidance around portfolio submissions in next phase. And then in terms of cohort guidance, and if you've signed up for one of the cohorts, we'll be providing additional guidance for that within the next couple of weeks. So there's a lot of moving parts there, but we're working diligently to figure that out and get that to you as soon as possible. And with that, then I'm just personally, I want to thank all of our speakers, and I'm going to turn it over to the commissioner who will close us out and answer any remaining questions.
Well, thank you, Bentley. I did get just a few questions. One was about the release I talked about, the joint release between the governor and DECAL, clarifying that police should not be pulling over child care staff as they go to and from work, whether or not they're obviously working in a center or maybe helping out at a family child care learning home. So that is all posted all over our social media. It will be posted on our website today. We've already asked for our IT team to do that. So look on the COVID-19 page, and it should be one of those top links so that you can have access to that. Also got a question about the shelter-in-place order, where I said that that does not close childcare in Georgia, and some questions about local mandates. So basically, the governor's shelter-in-place order supersedes anything that's been done at a county or city level. In fact, any county or municipal order that limits or prohibits the operations of childcare, family, or center directly conflicts with the executive order and is deemed invalid. So in real-world terms, that means your city or county ordinances that may or may not have said that or limited operation on childcare is null and void given the governor's emergency shelter order, which allows childcare to remain open. So I hope that is helpful and answers those questions. Those are the only types of questions that I received. So I will just say thank you for joining us again. We will continue to do these as we get more information. We want it to be a good use of your time and only provide updates when we have them. And just know that we're thinking about you or supporting you, whether you've made a hard decision to close your center or your family child care learning home, or if you made the really hard decision to remain open. We support you, and we know either way it was a tough decision and you're working hard either way. So hopefully more good news to come from those federal dollars. We will get those out as quickly as we can. Hang in there. We know this will all be over, and we will all recover from this one way or another, and we hope that you feel supported by us. So have a great rest of your Wednesday.
Thank you, and that concludes our webinar, and we will have this recording posted as soon as we can. Thanks so much, and have a great day.